This webinar is being recorded and will be posted in the California Project Launch website. Our presenters today are Rita Lang and Anna Gruber. Welcome, Rita and Anna.
Good morning. Thank you, or good afternoon.
Thank you, Lilia.
So we're going to start off, everyone, by saying good afternoon. We're glad that you joined us, and I'd like to start by reading my colleague's bio, Anna Gruber. Anna is a licensed clinical social worker and is currently the maternal, paternal, child, and adolescent health coordinator and unit administrator for the Alameda County Public Health Department. Anna received her master's in social work from San Francisco State University in 1997 and a bachelor's degree in sociology from UC Berkeley in 1994. She is bilingual, bicultural, licensed clinical social worker who has served children and families for more than 20 years. As the MPCAH administrator and Alameda County Healthy Start Initiative project director, she leads the integration, administration, program, and fiscal oversight of several family support programs for pregnant women and families with young children, looking closely at social determinants of health and the strength of our families to promote health. In this position, she supports a multidisciplinary and diverse MPCAH workforce to meet the needs of families and communities across the life course with specific attention to health equity.
Thank you, Rita. And now I'm going to introduce Rita Lang, my co-presenter, and we're so fortunate to be able to work together, or at least I feel like that. Rita Lang is a licensed marriage and family therapist who has worked in the field of human services for over 25 years. She is a graduate of San Francisco State University and Cal State University East Bay. Rita holds a Master's of Science degree in Educational Counseling Psychology. Her specialties include family system therapy, didactic parenting therapy, solutions-focused therapy, adolescent, child play, and expressive arts therapy. Rita has worked for a number of medical, school, and social service agencies providing comprehensive counseling services and believes in people's innate ability to find their way to health and healing. Rita's experience additionally includes program supervision, program development, consultation expertise working with a broad array of diverse communities. Rita currently works for Alameda County Department of Public Health in MPCAH as the Behavioral Health Clinical Supervisor and Program Manager for the Blue Skies Mental Wellness Team. Her consultation and program development work has been fundamental in implementing mental health integration efforts for MPCAH Behavioral Health Care Home Visiting Program integration. And we're happy to be your host for today's webinar.
Fantastic. So we're going to move forward and launch right in.
Next slide, please. So we're going to begin with talking about the right person for your home visiting mental health program. This webinar is very specific around talking about how to find the right mental health consultant for implementing home visiting programs and for providing support, consultation, and clinical services for home visiting clients, specifically in a public health department, but also for other agencies that want to incorporate mental health consultation into their home visiting programs. And we really want to talk about how we have a goodness of fit, so how the right clinician can really enhance and support your home visiting programs and ultimately support the families that you're serving through home visiting.
Excellent. Next slide, please. So one of the things that Anna and I have learned in working together and getting this model launched here in Alameda County is that it's very important to take the time to understand the mental health needs of the community that we're serving. There's no way that we could have created a program without being really, really aware of the dynamics of the families that we see, the types of families that we see, and the mental health issues that we're presenting in the community that we serve. And in learning that, we have learned not only to sometimes slow down and take it easy, but that we're learning the lesson that it's fundamentally important to just stay in a place where we can just slow down. We get a lot of press. We get a lot of organizational and institutional press to move forward, but in order to learn how to be a mental health program that is integrated into such a complex system, we often have to slow down, take it easy, so that we can have the right match for the community that we serve. Next slide, please.
So core content knowledge, what you have listed here are really the essential components, the core components of understanding mental health consultation and infant and early childhood support and work in looking for a consultant. So you will see here knowledge of perinatal mood disorders, absolutely essential and one of the primary modes of intervention that we're providing, not only consultation to staff, but interventions for the families that we see through home visiting. Of course, infant and early childhood mental health, another core component of understanding and experience in a mental health consultant. Of course, child development, typical and atypical, which sometimes is an interesting topic. We have oftentimes mental health consultants or mental health specialists who understand perinatal mood disorders, who understand mental health, not always having an understanding of child development. So to be able to have both is so useful, so helpful, so that we are marrying the mental health and the child development together, not only in home visiting, but in our mental health work as well. Understanding home visiting service delivery. Of course, cultural, racial, and linguistic responsiveness, a huge component since as many home visiting programs are, as with Alameda County, we are serving in our program, 80% are African American and Latinx populations. And then, of course, knowledge of child, family, and early childhood systems. Next slide, please.
So we want to, with keeping all of that in mind, which is a lot to keep in mind, we begin our search for qualified mental health consultants. And well-qualified mental health consultants may come from a variety of disciplines, but they need to have formal training, in our opinion, licensure that they possess, and knowledge and skills of multiple domains. So it is not the easiest match sometimes to find someone who carries all of these specialties, but we have held out to really try to find people who have this interest or want to obtain this type of level of training. And it has worked well for us in really trying to find a well-rounded individual who wants to do mental health consultation in home visiting. Next slide, please.
So domains of knowledge in mental health, infant, early childhood home visiting. So some clinical components that we're really looking for, a strong basis in mental health assessment and treatment and experience in that realm. Infant and early childhood health and development, very connected to what we shared about in the previous slide. Experience around early childhood home visiting programs, at least an understanding and really experience themselves in doing home visiting, I think is quite essential. I think we found it very different, those clinicians that have experienced home visiting in their background and those who have done more clinical work where the clients come to the office in a very traditional kind of 50-minute session, quite different from home visiting experience. Holding the consultative stance, so essential. And Rita, you're going to talk about that more in the next slide. A cultural understanding of the providers, of the programs, of families and children. I do think that we have a variety of home visiting programs here, and I think each one has their own culture, their own, professional culture, multidisciplinary culture, and so the right fit from understanding those programs and a mental health specialist that can really meet those needs. And then, of course, understanding community organization and resources, because we are doing so much linking and supporting, and having an understanding of community resources really so essential.
Next slide, please.
One more slide. That looks like maybe a duplicate.
Excellent. So I want to talk to you all a little bit about the consultative stance, and in our model, this is most essential to really be able to come in and do consultation from a perspective of holding an early childhood mental health perspective. That doesn't happen with every clinician because, as Anna mentioned previously, depending on a person's experience, where they've come from, where they've worked, their clinical training, they may come in with a certain approach. But when they come into our public health system and into our department, it's important for them to be really steeped in or begin to learn the importance of holding a consultative stance. And what that means is we're not coming in as an expert. We're not coming in knowing, because there's no possible way to know all that is needed to support mentally and clinically this diverse department. So that means we have to come in with a watch, wait, and wonder stance. We have to really come in and understand that our primary responsibility is that we're going to work to support staff, families, the programs, and community, and look at it as a shared mental health responsibility, that we're really all in this together and that we want to avoid being the expert. And I have shared with Anna on many occasions as this program has been launched that I believe part of the reason that we were able to be successful is we were able to sit with people and just be there and listen and hear and attend to what their presenting needs were, avoiding the expert model, avoiding the psychobabble, and being able to work collaboratively with people, stating that we were all here for the benefits of family and community. And so when you hear us in this talk refer to the consultative stance, that's what we mean, that we're coming as certainly expertly trained consultants, but consultants who are able to put aside our biases in feeling that we know all of the answers and being able to join with the teams and the programs and the community for a shared result of a good mental health effort. Next slide, please. So in Alameda County, in our model, to be able to have the outcomes that we've had, and I feel that they've been successful, we really wanted to start out with licensed clinicians. We could have easily started with interns. We could have easily started with lay students who had mental health training. But we found in our community, and when we were doing our initial needs assessments and thinking about the needs of our community, that they were so complex, that there were so many multiple problems that were going on, not only with the families that we served, but also the burdens that the workers were carrying in vicarious trauma loads, that we thought it was important to have licensed clinicians come in who'd be able to work with that and understand the intensity of what we were working with. So we've looked to hire successfully licensed marriage family therapists, licensed clinical social workers, licensed professional counselors, or PsyDs in our programs who have had practical experience providing direct service. And that is the key word. There are a lot of people, good people out in the community who have a lot of academic experience, but they may have not had experience working in the communities that we serve, and that's what we've been looking for, people who've done prior home visiting or community-based mental health. We've also looked for clinicians who have early childhood mental health training. They've worked with the EPSDT system of care, and they understand the field of infant mental health. That means the blending of developmental work with mental health work so that we can come up with best practices to support young families. We also looked really hard for people who have had one-on-one consultation experience. And many therapists have had the one-on-one consultation experience, but maybe not the group consultation. And in our model, we are also promoting group consultation where teams can come in or the therapist goes into their groups and offers that consultative stance that I'm talking about, where we offer the ability for the teams to have case review and facilitation and discussion of what they're bringing out to the community, where the mental health specialist has the ability to listen and join and try to really bond with that team in an understanding of the complex work that they're doing, and that the mental health specialist steps away when they come into that role from an expert model stance and just really is there with that team. And it's really been beneficial. The teams often tell me when I come in, thank you so much for allowing us to have this time and space to just let our hair down and talk about the importance of our work and the complexity of our work. We also look for the ability to support screening tools, and in our department we do many different screening tools. Different programs have tools that they have with varying degrees of results, but some of the basic tools that we use are the Edinburgh Depression Screening Scale. We'll use the ASQ for developmental screening, and in this, and recently we're going to start the GAD for generalized anxiety disorder. In this, our team is really working to work with the other teams to ensure that these screening tools are used effectively and that we can use them when we make referrals or when we work with the clinicians assigned. We want people to be creative joiners. So I remember when we started the work, we were asked, did we want to mandate people to attend? And I always felt like I really wanted this to be the choice of the program directors, that they, hopefully, that their teams would see the value. And sure enough, over time, there has been a value add as people understand what it's like to have mental health consultation. Lastly, and very importantly, it's important to consider the diverse talents of a team, and that's something that we are working on. People, clinicians can bring in various talents. Some may have specialties in different behavioral approaches, but it's very important to consider that to balance the team. People who have art therapy or expressive arts, cognitive behavioral approaches, people who are better in assessment or early childhood mental health diagnosis, specialties in substance abuse. All of these things come together to help you create a team that can better serve your community. Next slide, please.
So some lessons learned from the mental health specialists and our recruitment and hiring efforts. We want to seek a mental health specialist who has worked with specific populations, the populations that we have often served in our home visiting programs. So, these are some examples for us: single parents, families that have substance abusing parents, immigrant families, African American families in particular. We have a Black infant health program, as well as a Healthy Start program. We know that there are some counties that specifically serve in rural populations. They have other specialty populations. So those that can really lean in and be familiar with the population that the home visitors are serving would also reflect those that they have experience serving in a mental health context. We think it's really important to ask about past work challenges and work histories with specific communities. So have there been, in our county, there are often departmental transfers, or there are, different experiences where people have had working in other county systems. What has that experience been like for them? Very likely that they will have a very similar experience working for a public health home visiting program. Asking people about their implicit biases is also something that we're quite direct about and wanting to have conversations about. We ask our potential mental health specialists about their ability to manage and collect data. How do they work around paperwork? How organized are they? And what are their experiences with data collection? So that's always a question that we have in our interview with them. We often start our interviews with a general question around what their scope of clinical experience has been. What have they done home visiting? What is their experience around early childhood mental health? And are they willing to learn if they haven't done either of those? I will say, though, that the home visiting piece is really a core component for us. So while we will interview people who haven't had that experience, those that have, in one form or another, really do have, I think, an advantage.
They do. They stand out.
They do. It's quite important for us. And then, has their experience been solely academic, or have they had direct service experience? Because it is so important for us to be able to have a clinician that has that direct service experience and that home visiting experience. Connected to the home visiting, has the mental health specialist worked in a traditional office or clinic setting? Or have they had an opportunity to be in the community and connect with clients through home visiting? Is the clinician comfortable working with various populations that we are serving through home visiting? So is the clinician bilingual, bicultural in any way? I think those are absolute assets. Do they reflect the community that we are serving through home visiting? And I think that if they do, in some form or fashion, that is such an asset, I think, to having a mental health consultant and a mental health specialist who can, I think, understand and relate in a certain kind of way. Does the clinician have experience providing group consultation and or providing training? Our mental health specialists provide a lot of training to our home visiting clients, to our home visiting staff, and of course, consultation with our home visiting staff as well. And so as you can see, we've created these talking points as really a way to get to the heart of what we're looking for. And so to really think about these questions so that you can also get to the heart of finding the right mental health specialist in your recruitment and hiring efforts. Next slide, please.
So I think one of the things that we've also learned in the interview process and in trying to craft a team that can really be a team that's fully utilized is considering the workforce development options for growth for individuals. So I've often written a vignette that will provide an example of the types of cases that we see in the community, or a vignette that speaks to the consultative needs that may come in when workers are feeling distressed or overwhelmed, and then using that to open up the dialogue so that we can see how that clinician might handle that, and ask how the mental health specialist would think about contributing to our efforts. That's a really great question, because depending on how that person responds tells a lot about their willingness to kind of come in or their lack of ability of having that particular experience. I really also like to really inquire about the mental health specialist training needs and their desires for future growth. That will also tell you a lot about where a person is, what they're looking for, and where they'd like to go with their career aspirations. And then I think it's always good to develop a question to explore areas of expertise where people feel they might be a little stuck. And I think it's really important to, even if you find a candidate and say, well, wow, they don't have all of this, Rita, that's an awful lot to ask, that someone would come in with all of this level of expertise. But I think what you want to find out is at least where those holes or those gaps are, so that you can begin providing those training opportunities for your emerging team. So if you see that there's certain areas that are deficit in training based on what your community needs are, then you can start focusing, bringing in trainings or identifying trainings that will help elevate the need of that clinician. And then one thing that I found that's really, really a good question is to ask the person about their 5-year goal or plan. Most people say, oh, I'm really interested in this job. I really want the work. It looks great, the schedule. But then the thing is, where are you planning to go with your work? What are your passions? How do you see yourself working in the future? And that really does tell an awful lot about where an individual might be directed. Next slide, please. Some additional advantages for pulling together a team and a mental health specialist that can work well in your program is, of course, a person who has strong organizational skills. I think we've all worked with people who have not, and how that can really take up a lot of your administrative and reflective supervision time just trying to help a person get organized. So you really want to know where they're coming in, and if they're coming in, especially in a new program, with that skill set or not. If they can have people skills and a high ability for social emotional intelligence, because when you're working and consulting with a diverse array of people with multiple programs, or even just if it's one program in a large system of care, the person has to have that ability to flex and to flow and to work with very different types of personalities and situations. So that's really something that you might want to look out for. The ability to get along with emerging teams and challenging teams within a system, because that team may be coming together and joining with other programs, and then you want to make sure that that person is up for that charge. A lot of people can do really good, strong clinical work individually in their office with the door closed. That's something very different than when you're asking a person to come out into a large system and begin to build inroads and relationships. And early childhood mental health work is relational work, so we're really looking for people who have that ability to form relationships to different degrees. Of course, we're always looking for a team player and a team advocate, and I call it the ability to flow and grow. Somebody who can have a flow with them, that can move along, and then when they find that it might be overwhelming, because we all have those times, that they can come and say, you know, this is a little bit much, or maybe team member B should take this piece on, so we can figure out how to keep people flowing in the system of care. Of course, sensitivity to understanding the complex dynamics of organizational development. This is like, if you were watching me now, I'd be raising both hands and a foot. It's very important to have understanding of the complex dynamics in an organizational system, because this is where we're working. And so if the individual clinician gets so hung up on their own personal issues or on the system's inability to meet their needs, it can bog down the work, right? So we really want to look at people who have an understanding of complex dynamics in organizations. And I might add, in this day and age, where are we not working with really complex systems and complex organizational dynamics? It's pretty much part of the course now for most mental health professionals. So you really want to look out for that, ask questions about that, about how people are willing to either seek expertise and knowledge or find ways that they can get supportive, reflective supervision around the changes that they'll be encountering in complex systems. I think it's important for the mental health specialists to have received training on vicarious trauma. Here in Alameda County, we're in the Bay Area, and we're in a very, very complex environment, multicultural, multidisciplines that we're working with. And then our families have experienced so many things when they come into our home visiting programs. And so that mix often makes for a recipe of toxic stress. And people working in that toxic stress environment have to be aware of what they're experiencing and have to know how to put some good, clear limits on their self-care and their self-awareness to be able to do the work. And then we want to make sure that people experience regular and consistent reflective supervision. We hope that they've had that experience. If not, we like to talk to them about what a reflective supervisory experience would look and feel like, so that people can feel comfortable with that model. Lastly, can we determine when self-care is required? And I have a question on all our interviews about what do people do for self-care to avoid burnout and to prevent their overexposure to toxic stress. And you'd be surprised what people say. I mean, most people have some general answer, but we really want to get down and deep with this and say, well, what really and truly would you do when life circumstances start to really impact your work? Next slide, please.
So some of what, Rita has shared, at some point, Rita, can we find someone that has all of this? But we do have some kind of basics around some must-haves, some things that we really find are absolutely essential for a mental health specialist to be able to hold and have and share in an interview and in their experience when they come and apply for a job. And one of the primary things is really the ability to work in a multidisciplinary team. So I'm sure, as in many public health systems or with other organizations, there are public health nurses, outreach workers, health educators, case managers, social workers, other specialists, depending on which home visiting program you are implementing, and to have a mental health specialist that can really work with all types of disciplines, those that are perhaps have staff who have higher education, and those that are working as paraprofessionals equally need the support and consultation of a mental health specialist. And so one that can really bend to the needs and the requests of staff, I think, it's hugely important. The second is team building skills and the ability to seek the understanding of the other and working with many disciplines and perspectives. I think that really speaks again back to the consultative stance and really being able to sit and listen and support, not always be, the mental health expert sitting across the table, but really be able to link with the teams and for the mental health specialist to feel part of the team. In Alameda County, for example, our mental health specialists, we have one assigned to each of the various programs, and they participate in staff meetings regularly with those programs. So participating in Black Infant Health Group team meetings, participating in Nurse Family Partnership or Healthy Families America staff meetings, so that when they do come in to provide case consultation and they are participating in case conferences, they feel like they're part of the team. And they're really able, I think, to link and join with other people and other perspectives. Understanding the role of the mental health consultant that will provide individual and group case review and individual consultation with staff. So what does that mean? And I think sometimes it takes some time for people to understand that they're not providing therapy to staff. They're not there as the expert in a case review process or in a staff training, but really be able to connect, provide consultation, be listening, join as part of a team, and work across disciplines is really so important. And, just to say, we learned this pretty early on in the very first project launch. How long ago was that, Rita, that you were?
Over 6 years ago.
Over 6 years ago. And, the initial idea was that Rita was going to provide mental health direct services and supports to these various programs. And one person simply just could not do it. So that's really where the concept of providing consultation to staff to then help them with their families and their clients really grew, and how effective that was.
Exactly. And I think, Anna, just to add to this, in all of this, keeping mental wellness in the forefront, it's easier said than done. The skill set for that clinician that you hire to be able to always have the mindset or the wherewithal from their manager to say, how are you really doing with all this? This is a complex charge. And so are you keeping your mental health in the forefront so that you can model to teams what is an effective approach to being able to do this work in our systems of care? the ability for that individual to be adaptable and flexible, and to be able to just sit and say, you know what, wow. I've sat in many consultations and said, wow, this is really, really something else. We need to take a breath, and maybe we need to not rush off to the next topic next time, but we need to just come right back to this. And then lastly, seeking joy in the work. It's really, really easy, and especially for people who are new to the field and they're extremely exuberant about the work and they have passion in the work, but the work can wear on you. And so I like to always ask the question about, what do you do to allow yourself to stay in for the long haul? How can you continue to see joy after you've seen so many families in trauma or so many families with critical mental health needs? So those are some good questions that you might want to get in and think about as you consider hiring. Next slide, please. So one of my favorite things to do is to demystify mental health and wellness. I think we live in a really wonderful time now because mental wellness and mindfulness has almost become cliche. It's everywhere we look. It's in advertising. It's in our healthcare systems. And everyone talks about mental wellness. But my thing is talking to people about, what does that really mean? It means different things to different people. And so when you're looking to hire a person, one thing you might do and strategize and consider is asking them, what does mental wellness mean to them? And for me, it's a combination of wellness and understanding of mind, body, and spirit in practice. For someone else, it may mean something different. But oftentimes people can say that, but then I always say, but what are you doing, right? To say it is one thing, but what are you doing in your life? And then also another great thing to ask people is, how would they demystify a mental health diagnosis? If there's a complex diagnosis out there and this clinician is used to working in a medical system or a medical model where everything is clearly written out, or prescriptions or diagnoses are used in writing and thrown around, this is very different in a home visiting system of care. How might that person interpret that information in a non-threatening way and be able to give that information out to the programs that they're working with and to the families that they're working with, so that the person doesn't feel the stigma or the weight of the mental illness? So that's something just to think about, that it's, as you look for qualified staff, particularly if you're in the home visiting arena, how can we make mental health feel like it's a gift to a person and not a burden? Access to mental health as a gift and not a burden. Next slide, please. So this is what I mean, that we can always look for obtaining mental health either as a fountain of wellness, or it can be a secret, hidden fact. We'd like it to be a fountain of wellness. And particularly in our communities nowadays and in the world, we need mental health more than ever. And we need qualified consultants and clinicians who can bring mental health, equalize mental health, offer it in a way that people feel like, jeepers, I really want some of this and I want to find a way. That's what we're looking for in a competent mental health specialist. And does it seem like a big charge? I think it is, but is it worth investing in? Most definitely. I think we can change our communities one family at a time. We can change our consulting models one family at a time by being clear on sharing what we can bring in terms of a wellness and a health perspective.
Nice. Thank you, Rita. So next slide. So this, here is our information. We're open to questions from the chat box, so please type in your questions. We'd love to hear from you. We'd love to know what you're grappling with in hiring a mental health specialist, and love to share some of our thoughts. And as you are typing, Lilia, is there one more slide that shows the project launch information? Wonderful.
Excellent.
So this is the project launch website. We are working over the next couple of weeks, and we will be adding more information around mental health consultation and home visiting. We're going to be adding on this website job descriptions, interview questions, more formal interview questions, examples of what we have, information around what makes mental health consultation and home visiting, the various components, as well as a recording of this webinar. So there you have it. I'm not really seeing any questions, but we can wait a little bit longer in case people feel inspired.
And we hope we answered many of your questions, or at least got you to begin thinking about what might pull together some ideas on hiring the right consultant, mental health consultant for your program. It's always hard for me, being such a people person, to present like this and not be able to get the feedback or see the faces or hear the voices. But we are here for you, as Anna mentioned, and you can reach out to us through email, again, if you have other questions as we wind down our TA consulting for Project Launch. And we wish you the very best in whatever you're doing in trying to bring appropriate mental health services to your community.
Great. Okay. So I don't see any questions. Maybe we've been thorough, or maybe you're still thinking about them. And, you know, again, you can always email Rita or I directly, and happy about that. So thank you for joining us this afternoon, and we hope you have a good day.